Your doctor has told you that a tumor ablation might be right for you. Maybe it's in your liver, your kidney, a lung, or somewhere else. And now you have questions. Will it hurt? Are they going to use radiation? How do they know the whole tumor is destroyed? And if the tumor is killed inside my body, where does it go? These are exactly the right questions, and this video is going to answer every single one of them, calmly, honestly, and in plain language. Let's walk through what's actually going to happen, before, during, and after. Tumor ablation is a procedure that destroys a tumor without surgery. There's no large incision, no operating room removal of the tumor, no cutting around it and lifting it out. Instead, your interventional radiologist uses a thin probe, about the size of a thick needle, and guides it through the skin directly into the tumor. Then energy is delivered, either extreme heat or extreme cold. That energy destroys the tumor cells right where they live. The probe comes out, nothing is left behind, and your body quietly heals around the treated area. We call this what enters, what leaves, what stays. And that's exactly how we're going to explain it. First, what enters your body? The first thing that enters is the probe itself. It's thin, far smaller than a surgical incision. Your team makes a tiny opening in the skin, about the size of a pinhole, to pass it through. But here's the key. Your team doesn't navigate blind. They use real-time imaging, usually a CT scanner, sometimes ultrasound, to watch the probe's position every step of the way. On the screen, they can see exactly where the probe is, where the tumor is, and how close the probe is to any important nearby structures. When the tip of the probe reaches the center of the tumor, they stop. Now, energy is delivered. There are two main types of ablation energy, heat and cold. If your team is using heat, they may use radiofrequency ablation or microwave ablation. Radiofrequency ablation uses electrical current that generates intense heat right at the probe tip. Microwave ablation uses microwave energy, similar to how a microwave oven works, but focused precisely at the tumor to generate heat even faster. Important, this is not radiation therapy. Ablation heat comes from electrical and microwave energy, not from radiation. CT imaging guidance does use a small amount of X-ray to help your doctor see inside your body, but no radiation is delivered as treatment, and nothing radioactive enters your body. If your team is using cold, that's cryoablation. A pressurized gas flows through the probe, making the tip extremely cold. This creates what's called an ice ball, a sphere of frozen tissue that forms right around the probe tip. Whether heat or cold, the goal is the same: destroy all the cells in the tumor. Your doctor calls this area the ablation zone, the region where cells are destroyed. It's designed to cover not just the tumor, but a small ring of healthy tissue around it, a safety margin, to help make sure no tumor cells are left at the edges. One of the most common questions: how do you know you got all of it? Your team monitors the ablation zone during the procedure using imaging. They can see the treated area taking shape on the screen, and they're watching to make sure it covers the full tumor. After the procedure, usually several weeks later, you'll have a follow-up CT or MRI scan. That imaging tells your team exactly how the treated area looks now that your body has had time to respond. Your radiologist and oncology team review those images together and let you know what they see. Follow-up imaging is not just routine. It's an essential part of the treatment. Once the ablation is complete, the probe is removed. That's it. It comes out completely. Nothing is implanted inside you. No device, no marker, no hardware. Your team covers the entry site with a small bandage. For most patients, no stitches are needed. The probe entered, the probe left. That part is finished. Now, the question patients ask most: the dead tumor is still inside me? Yes, and that is completely intentional and completely safe. The destroyed tumor doesn't need to be removed. Once the cells are dead, they can no longer grow or spread. Your body's own healing process takes over. Over the coming weeks and months, Your immune system gradually breaks down and reabsorbs the treated tissue, the way your body reabsorbs a bruise. The area shrinks. It may become a small scar on imaging. Over time, it may barely be visible at all. Think of it like a scar forming on the inside. Your body quietly absorbs and replaces the treated area over time. This is not a sign that something went wrong. This is healing.
Will it hurt?
Before the procedure begins, your team will apply local anesthetic to numb the area where the probe enters. You'll also receive sedation through an IV, medication to keep you relaxed and comfortable throughout. Depending on the tumor's location and your team's approach, you may be under deep sedation or general anesthesia. Your care team decides what's safest and most comfortable for you. Most patients feel little to nothing during the procedure. Some notice a sensation of pressure or warmth during heat ablation. If that happens, let your team know. Afterward, it's normal to feel sore at the entry site for a few days. Some patients also experience what's called post-ablation syndrome, a few days of flu-like feelings, mild fever, fatigue, aches. This is your immune system responding to the treated tissue. It's a normal part of healing. Most patients go home the same day or after one night in the hospital. Your team will give you specific instructions for activity and what to watch for at home. Let's clear up a few common misunderstandings. Myth: ablation uses radiation to treat the tumor. Not quite. Heat ablation uses electrical energy or microwave energy, not radiation. Cryoablation uses pressurized cold gas. Your imaging guidance uses a very small X-ray dose, the same as a diagnostic CT scan, but nothing radioactive enters your body as treatment. Myth: leaving the dead tumor inside me is dangerous. Once destroyed, those cells are no longer living cancer. Your body safely breaks them down over time. This is the intended outcome, not a complication. Myth: if I can't feel the probe, it means it's not working. Sedation is designed so that you're comfortable and unaware. The procedure works whether you feel it or not. Myth: cryoablation freezes my whole organ. Only the area immediately around the probe tip is frozen. The ice ball is contained and carefully sized to match your tumor. Let's bring it all together. What enters? A thin probe is guided through the skin into the tumor under real-time imaging. Energy, heat or cold, destroys the tumor in place. What leaves? The probe is removed completely. Nothing is implanted. Nothing stays behind that was brought in. What stays? The destroyed tumor tissue stays in place and is gradually reabsorbed by your body as you heal. Follow-up imaging tracks the treated area over time. Your team planned this procedure specifically for your tumor, your anatomy, and your health. Every step, the probe path, the energy choice, the safety margins, was chosen with your safety in mind. Write down your questions before your pre-procedure visit. Ask your interventional radiologist anything you want to know. There are no wrong questions. You are not facing this alone. And now, you know a little more about what's coming. This video was produced for patient education by RadVeritas. It does not replace the advice of your medical team. For more videos in this series, subscribe and share this with someone who could use it.